Welcome to Foundations of Indigenous Harm Reduction. My name is Casey Deems, and I'll be running today's web forum along with my colleague, Jeff Bornstein. Today's web forum is sponsored by the National Overdose Prevention Network, a program of the PHI Center for Health Leadership and Impact, and produced by Dialogue for Health. Next slide. Now let's meet the moderator of today's event, Dr. Mary Maddox Gonzalez. Dr. Gonzalez is a coach and preparedness consultant for the California Overdose Prevention Network, a program of the PHI Center for Health Leadership and Impact. She served as the Sonoma County Public Health Officer and Division Director and the Chief Medical Officer of the Redwood Community Health Coalition for Sonoma, Napa, Yolo, and Marin counties. She has been a board member and chair of the Latino Coalition for a Healthy California. Welcome, Mary.
Thank you so much, Casey. And it's my pleasure to welcome you all to today's webinar, our web forum. And I know you're going to find this of particular interest. We're just seeing a tremendous enthusiasm for today's presentation. Could I have the next slide, please? So we're going to start off with poll questions. Then you're going to have a really fascinating presentation on the foundations of Indigenous harm reduction. And we will have an opportunity for questions and answers. So we do encourage you to put your questions into the Q&A at the bottom of your screen. And we will get to as many as possible. We're thrilled that there's so many people joining us, but it means that we will get to just as many questions as possible during the course of our presentation. Can I have the next slide, please? So you'll be learning about a wonderful new resource, and that is the Native Harm Reduction Toolkit. You'll also be getting insights into some of the principles and applications for Indigenous harm reduction. And you have great resources that you can use for whether you are a Native or non-Native provider, so that you can offer culturally appropriate harm reduction and treatment services to Native community members. Next slide, please. Okay, well, now it's my great pleasure to introduce our speaker for today. Arlene Brown is the founder and CEO of Crosswords Recovery Center and Skoden Native Harm Reduction Services, which is the first California state certified syringe program that is specifically created for Native people. Previously, Arlene served as a Kaufman and Associates Tribal Training and Technical Assistant Specialist. She provided culturally appropriate support to tribal communities for the Kaufman and Associates contract to implement the major California statewide initiative. And in that role, she identified and integrated tribal best practices into opioid and methamphetamine treatment for urban Indian and tribal communities, and supported the tribal traditional best practices and substance use disorder integration initiative. Arlene has more than 15 years of experience providing organizational leadership, community outreach, and education to tribal communities. She is a member of the Bishop Paiute Tribe. And it's my great pleasure to welcome you, Arlene, and thank you so much for joining us today and sharing your insights and this excellent toolkit that you have developed. Welcome.
Thank you. I am honored to be here, and Manahu Inanine Arlene Brown, and I am a member of the Bishop Paiute Tribe, and that is where I live, and that is where our recovery center and our Native Harm Reduction is located in Inyo County, Bishop, California. And I have the honor and privilege to sit on a variety of boards that I think have really made this work super impactful. And some of that is just being on the National Tribal Opioid Litigation Settlement Funding, the Strengthening Syringe Service Community Advisory Team, which is a newer organization, and the Network for Emergency Addiction Treatment that was started by the National Bridge. Next slide, please. So two of my favorite things, harm reduction, and then talking about decolonizing services. I absolutely love that. We just got back from the National Native Harm Reduction Summit, and you know, what I shared there was like, we decolonize everything, right? We make it our own. We have, as Native people, we've had our own ways of healing for generations, right? They've been passed down. So we we know what our healing is, we know what our traditions are, we know our culture when we're brought up in our culture, and some of us have not always had that opportunity to know what those are, and there's a disconnect. And when we talk about using substances, there's a disconnect there too, because a lot of Native Americans will put their culture down when they pick up substances, when they start to drink alcohol, because we have a lot of traditions in our culture that say, you know, you cannot go pick medicine if you're intoxicated. So we have I don't want to call them rules, but we have a lot of sacred knowledge. And so out of respect for a lot of culture and tradition, a lot of natives will kind of turn away from that piece of it and learning and participating out of respect for the culture and tradition. And so on one hand, we always talk about culture being prevention as well. And so what we get when people are using drugs, we get them further isolated and we get them even more disconnected from their culture. And nobody gets well in that space, right? And so I talk a lot about, you know, keeping our loved ones in that sacred circle with us, that everyone is worthy of that space, and that we need to make sure that we're not further isolating, and how do we keep everyone connected, and that we're not, you know, having that different opinion of people shaming them for using drugs and alcohol. When we don't want that. That is the opposite. We know we can't criminalize and punish substance use out of people, and that's not how things work. And we've had years of seeing that. And so I love harm reduction. I love how it acts as a bridge to connect us, and it works. And so I'm always happy when I get to talk about harm reduction, because hopefully, like, all of you can leave and have a better understanding, and think about how you can decolonize services, or how you can just, I mean, it's basically connecting with people, right? Heart to heart. Next slide, please. So one of the things I always think about is the fact that our Native people have some of the highest fatal overdose rates in the country. And so I always feel like we're on a urgent call to be able to try to reduce that. And so the more resources we can get out there, the better. And so saving our people is directly related to saving our culture, and that is a priority for us. And so we have to be able to address the opioid epidemic as it makes sense for our tribal communities. And that requires an approach that encompasses a lot of different things. Next slide, please. And I just quickly really want to acknowledge the National Harm Reduction Coalition for recognizing that there wasn't this voice at the table for Indigenous harm reduction. And so they worked really hard. They did a survey in California, specifically with urban and rural and reservation natives, to say, what are the needs? What are the barriers? What do you guys need? And so based off of that survey, we created this toolkit after that was done on different themes that were really picked up. And some of those themes were talking to tribal leadership, getting more Narcan out there, reducing stigma. And so based off of that, that's really how this toolkit came about. And then I had the honor and privilege to see it through. And so I really want to recognize, one is that they seen that we were underrepresented with national harm reduction, and that they said we're going to do something about it, and they went out there and did it. And now we have a toolkit. The toolkit is full of a lot more resources that they gathered, all from Canada and across America as well. Next slide, please. And what I talked about earlier is the importance of having a cultural lens in some of the key aspects to consider when working in tribal communities or with individuals. And that we do have this cultural lens, right? Like, we see the world and experience the world different than others as far as our worldview, how we view our community, our family, how everything is more circular for us and not so linear. When we talk about Indian time and our humor and our resiliency and our shared historical trauma that we have gone through, that all really plays a factor into this as well. And the war on drugs. I always like to share with people too that, you know, when people talk about the war on drugs, they miss the fact that in 1621, all the way back then, was one of the very first incidences here in Plymouth Colony when they were trying to regulate the use of alcohol. And so the war on drugs really has a long history and goes a lot farther back than what some people will even share. Next slide, please. And then just really quick, basic harm reduction. I think it's beautiful because harm reduction is so fluid and can go, it's in everything that we do, right? And so but it should look like, not judging people, compassion, meeting people where they're at. There's flexibility in it. It's not oppressive by any means. And then so on the other side, just a reminder of what harm reduction is not, it's not rigid and it's not fear-based, it's not punitive, it's not stigmatizing a person again. And it's not focused solely on abstinence. I think, we have a big understanding, or I know even for myself, used to have this understanding that drug use was always chaotic because that's how I grew up. And I grew up seeing people using drugs on the whole other side of the spectrum where it was very chaotic drug use, or the alcohol use was very chaotic. Not this, I can go out and drink 1 or 2 beers and come home. I never really experienced what that looks like. So when I grew up, and when I had this, and doing this work in the field, I had this idea that it was like, everyone's drug use was chaotic. Everyone's drinking was chaotic. And that's not true. There's like a whole spectrum of drug use, right? Where some people can actually use drugs in a more safer manner. And I had to put my opinions aside because I came into this work with a lot of opinions about that and what that looked like because of my own personal experiences and what I actually had seen growing up. Next slide, please. So some of the foundations I think about, and this list can include more things. You can cut things from your community if it makes sense, but I always think about culture first, meaning culture isn't an afterthought. We don't look at what the service is and then think, how do we add culture into that? This is our culture, this is our tradition, this is our way of doing things, and now we're going to add the service. And so it's really taking that whole shift and saying, I see this through our culture. When I look at how medication is used, I see it through my culture, and I see how it makes sense. And I'm going to explain a little bit more about that further along, but that's really what culture first is talking about. Community involvement and empowerment, holistic health, this idea of self-determination and autonomy, like we talked about, non-coercive support, non-judgmental, education and awareness, and comprehensive services, which would be included in that. Next slide. Culturally relevant resources, that those make sense for us, that we have images, signage that we can see ourselves in those images. Otherwise, we don't identify so quickly when we see that. Healing from historical trauma is a big piece of this. Collaboration and partnership, advocacy and policy change, and adaptation and flexibility. Next slide. And the foundations ensure that harm reduction strategies are effective, culturally appropriate, and sustainable within Native communities. I love this idea of being able to take these ideas and that we're able to replicate that into whatever tribal community that we're working with within your own communities, and that we're able to make it make sense for ourselves. So people's ceremonies look different, how they adapt things. And that's the beautiful part about doing this work, is that you can kind of have, these foundations, and everyone makes it their own. And so it doesn't look the same in every community. Next slide, please. So with culture first, so one example that I think about when we're integrating strategies that work and that we're really being able to recognize traditional norms, values, and beliefs. So when you come into our office, this is one of the signs you see. I'm really big on signage and inviting conversations, especially in the work that we do. But we have this up in our office, and it's a large poster, and it just goes to show people that, I can talk to them about safer using. I can talk to them about prayer. I can talk to them about, getting overdose reversal kits. And so what we're really doing is just inviting that conversation and letting people know, hey, we're safe people to talk to about this. We can talk about detox. We could talk about stopping use, slowing down. So that's really what that sign is for. Next slide. And then respecting our traditions. One of the things that we've really worked on hard is making people, our natives especially, who use drugs, making them still feel like they are part of the culture, that they have not been isolated, because that is addiction, right? Like isolation is the biggest piece of addiction. And so the opposite of that is always connection. And so if, we want to further stigmatize and isolate, we're going to, ostracize and put them out, label them as bad. And then they're not going to be part of our circle anymore. And so they're going to stay on the outside and they're not going to get the help. And we're just going to keep the cycle going over and over. So one of the things that we do is we know that, one, we collect the medicine, but when we go out, we talk to people like, when's the last time you smudged? When's the last time? And they'll say, oh no, I haven't smudged in a long time. And so we collect the medicine and we offer that to them, and we'll give them shells and we say, you can smudge. And we talk about those differences of where it's not appropriate that they go out and collect the sage themselves. Because that would be, in our tribe, that would be very disrespectful to be under the influence, and then going out and collecting sacred medicine, right? And so these are the ways that we have found like harm reduction really bridges that. So we're able to give them the medicine, but they can't collect it. And I hope that makes sense, but I really point that out because that's one way to keep everyone's culture at the forefront. Next slide. And then for community involvement, this is such a crucial piece of doing our harm reduction, but here's an example that we did. We did a tribal proclamation and we talked to the tribe, and specifically my tribe, and I did this also down in Bakersfield, but we did a tribal proclamation for Overdose Awareness Day, had an event. And so we're really focused on helping to empower leaders, because what I found in this work is that tribal leaders are overwhelmed with the death rate. They have, shared at national meetings that it is more common to go to funerals now than it is birthday parties, that it's becoming more normalized to bury our loved ones. And so being able to empower tribal leaders from health boards to tribal council is really important, and helping them kind of find that way to do that, right? And so when I presented the proclamation, they were on board. We did a huge drive-through event. We had over like 200 people come through, and then we, trained everyone on overdose kits. But that really helps helps empower them so they feel like they're able to make a difference, and we keep them engaged because we need our tribal leaders to support that work that we're doing as well. Next slide. Empowerment of our community. So here's an example. So we did an event, and so we always have our booth at the powwow. And what I did learn from working at the powwow and doing the event was we need to have kid prizes. So many kids wanted to come over and spin the wheel, and I didn't even take the children into account because that wheel was like a prize wheel for adults, and there's so many children at the powwows, right? And I was like, oh my gosh, how could I? Like the very first night I was there, I was like, kids just kept coming over and they wanted to play, and I'm like, I don't know, I don't have any kid prizes. Like, I was so bummed, and I was like, how could I not think about the children when we were doing this event? And so, and we think about the youth a lot in what we do because we want to do a lot of prevention. Well, anyways, so having a booth that was geared towards adults at a powwow, that didn't go down so good with me. We ended up giving kids, all these like t-shirts. So I need to like stock our bags. So we have a lot of kid prizes and engagement pieces there, just for the youth. But, we learn as we go along, right? And this is our family. We call them the cycle breakers. And so this was being able to engage with people and do harm reduction approaches. They were not fully sober when we started to engage for services. And then because we just kept working with them and empowering them, and meeting goals, like through all of it. He became employed for the very first time. I was working at a restaurant at the time. They were working on housing. They were homeless, actually. So we had worked with other agencies, but there was never this thought like you have to be sober before you get the help. I think there's a lot of, sometimes there's these barriers that have just been kind of put in place to say, well, if you're not sober, you can't quite get the help, right? Well, they couldn't get the help. And so we were able to help them. And we knew that we had those honest conversations that they weren't sober, but we weren't judging them and saying you have to be sober to get help, you have to be sober to get housing, do any of that. No, we just kept empowering them and helping them with their case plan and making good decisions. And through that all, they, like I said, they were cycle breakers. Very proud of this family for doing that work and like hanging in there, because it's not easy. Next slide, please. And then community involvement has always been a really huge piece of the work. So this is one of our overdose prevention events, and then putting the community to work to make overdose reversal kits. So I had them make like 200 kits, and this is people, community members, people from different agencies. And it was like right before the event. And I remember thinking too, before that event, this was a couple of years back, but I was like, oh my gosh, how am I going to get all these kits made? I didn't have the actual manpower to do it. So I was like, you know what, bring all the stuff to the event, and then just make an assembly line and then like show everyone what to do. And they all just went to town, and, they had such good conversations about it. And again, the empowerment, they felt really good about taking part in making overdose reversal kits, that they know that that was going to get into the hands of people who needed it. And so lifting up our community and empowering them to do that work as well. Next slide, please. That holistic health. So Western psychology, Western medicine has really caught on to our Indigenous framework, and they'll call it whole person care or person-centered care. Well, as Native people, we've always known that you have to treat the whole person. You can't treat just one bit or part of them. So so holistic health really refers to that, and that we are treating the whole person, right? And so what that means for us, we're addressing every piece from the physical, mental, the emotional, and spiritual. We put it into the medicine wheel, and I'll share a little bit more about that. But our harm reduction strategies really aim to support that person and in what their goals are, and to bring that balance into their lives. Next slide. So what that means for indigenizing harm reduction services and how we bring that in. So if you guys are familiar with contingency management, which was created to really address stimulant use disorder and is an evidence-based practice, right? And so we took that model and we created the wellness journey. And so it's only for people who are currently using drugs or alcohol. And we go out into the community. We run it for 8 weeks. Now, traditional contingency management, what they found was 12 weeks was kind of the sweet spot for really making a difference. With all the different research studies they did, it was anything, less than that wasn't effective. Anything longer than that didn't prove more effective. And so 12 weeks was really the sweet spot. And then doing it twice a week. But, the goal that they were targeting was abstinence and, doing urine drug screens and whatnot. So we actually do contingency management for people in the office here to support their recovery. And so we do one for sobriety, and then we do this wellness journey, which is specifically, like I said, for people who are currently using. And we do it for 8 weeks, and we go out into the community. Here's a picture of us setting up our table. We go into a lot of encampments, and so it's really, the one thing about that is like we can go there, and there's like 5 to 8 people who will come out, and so they'll all take their turns. They'll fill out their packets. Now the wellness journey is really, it's set in the 4 directions. So their packets are made for them to each like reach different goals, like spiritually, physically, mentally, and emotionally. And it's weekly case management for them. we actually put a like language in there, like the tribal language. We put a lot of culture in there, and so we have like cultural prizes. The sage isn't a prize, but we always carry our sage with us, and because we, always offer that when we're out as well. And then we usually have food with us, and like I said, we'll do this for 8 weeks straight, and then we'll stop, and then we'll open up another 8-week session. And so they just go, they win their prizes, but when they fill out their packets, it could be like a strength-based packet. So then they're looking at their goals, or like focused on like what are their strengths, and then thinking about listing those strengths, right? It's all about empowerment. We do, there's nothing in there that says like, we want you to get sober, or you have to get sober, or that is even a goal. We never push the abstinence part. But we do really encourage, and we'll incentivize people getting set up with a primary care doctor. We'll incentivize them getting tested for HIV, Hep C. And and if they want to meet with one of our addiction doctors, we'll incentivize that. And the conversation isn't about, how can I cut my use? How can I do this? It's more education for them, for the doctor to be like, okay, so this is what stimulants are doing to your heart. This is what tachycardia, this is what, and how do you keep safer through that? And so, but I do that with a safe doctor who's not going to shame them, and they specialize in addiction. And so I know that they're going to be welcomed, and that they're really focused in harm reduction and grounded in harm reduction. So they're not stigmatized. And so we have a safe place to do that. And then, like I said, we really incorporate our tribal language into the things that we do. So we put that in there, and then they're getting more connected with our culture and language in that setting. And we do it mobile, and then we'll do it in the office as well. Next slide, please. And then, so these are some of the prizes too, like on the wheel, we'll label different things. We'll have like a household basket with cleaning supplies. We'll have self-care items. We'll put like culture basket. And so when it lands on that, they'll actually get to pick from a culture basket. And this is an example of what our culture basket looks like. And a lot of the gifts have been done by local artists in our area. And so we always do pre and post surveys. And so what is really significant though with this, and it always, our engagement is so huge. I just love this part. We've had, 67 participants, and well, I did this probably like 6 months ago, so we have more, but this was the last time I did it, and 90% of them said it increased their healthier choices. 87% said it decreased drug use. 87% said it helped them set goals and achieve them. 62% said it increased their access to healthcare. 100% said it increased their self-esteem. 75% said it decreased isolation, and 87% said it increased their access to culture. Now, when I take a step back and I think about what addiction does and how it ravages through our community, and how, this wellness journey is like doing everything we want it to do to help our people heal and get well. And so this is one of my favorite programs that we run, and I love going out there. And the other part is that we're not stigmatizing, we're not shaming, and we get people right from the syringe exchange program into rehab, or we do detox, help them through detox. And so because we're building those trust relations with them, and we haven't heard too many people be like, I love this lifestyle, I want to stay out here forever. No, people are like, oh, so what do you mean I don't have to live like this? What do you mean there's help out there? So then we get to have those conversations. Oh, you can help with rehab? Yep, absolutely. We've literally have gone out in the field with scanning documents out there to gather their stuff to get it into a treatment, to get them into a treatment center, right? So we like coordinate that care. And so harm reduction absolutely is healthcare. Harm reduction is its own medicine, and it engages with them. And the biggest thing is that people have thanked us for treating them as human beings. And I will share that like probably in every presentation, because I don't normally go around thanking anyone for treating me like a human. Right? I get that respect from people. I never feel like I'm less than. And so it always stops me in my tracks. So because it's happened more than once. And I always think, how have you been treated? Because you use drugs, and you know, we can go into all of the reasons why people use or how they, you know, and it's really, there's so much trauma behind it. There's so much sadness. There's a lot of tragedy behind the reasons people start using drugs in the first place, right? So anyways, it always breaks my heart and stops me when people do thank me for that, because it makes me sad to think how mistreated people really are when they're using substances, right? And then they don't get the help that they need because they're discriminated against, they're looked down upon, they're looked at, you know, moral failings, they're looked at, you did this to yourself. You know, and we know people just don't get here overnight. We know that it wasn't a choice for them when they first were like, man, today, you know, sober, never tried drugs or anything, to say, man, I'm going to go get a needle in my arm. I'm trying fentanyl for the first time. I'm going to live under the bridge. People just don't start out that way. Next slide, please. Self-determination and autonomy, like we talked about, the no judgment, stigma, understanding that we're just promoting their wellness. We're promoting them and their choices and empowering them to make those. And we want to meet our most vulnerable where they're at. Next slide. So we do have a syringe exchange program, like she mentioned, and these are just examples of the pipes. Now, we reduce mortality rates by handing out, like the middle one is a hammer pipe specifically for heroin and for fentanyl. And so we've had overdose deaths because people have used smoked fentanyl out of other pipes, and then the next person doesn't know or found the pipe, and they literally have overdosed because they found someone else's pipe, not knowing what was smoked out of it. So we use a lot of these as tools and education to say, hey, use the right pipe for what you're doing. And so we can reduce fatal overdose deaths that way as well. And it's a huge engagement tool. Not to mention people can contract Hep C as well through, people always think just needles, but through pipes as well. So next slide. We give out hygiene kits, but we created snack bags. So we label them different, and it just has toiletries in there, but that's one way we've done that. Medication lock boxes and bags, we give those out to not only people in recovery on MET, but also to people in our syringe exchange program, and really talk to them about the importance of keeping things locked up, out of reach, and out of the way and safe, just like we would any other medication. Next slide. Education and awareness. We focus a lot on raising awareness for our community, and not just the harm reduction principles too, but safer practices and letting people know about the different resources. Next slide. So messaging is really huge. So we talk a lot about the dangers of counterfeit pills. People don't know the danger, and we can't assume that people understand about pressed pills and how fentanyl binds to itself, and why you can't just split a pill in half and then half it again and make it safer. So we get to have those talks with the community. That's our Narcan float. It's been in our Christmas parade. It's been in our California Indian Days parades. We've had a Christmas tree over it. It's a really awesome float. And we've gotten some really good responses, but raising that awareness as well. Next slide. And then our culturally relevant resources, like we talked about. Next slide. So helping people in our tribal communities understand the importance, because there's a lot of stigma in general, sometimes around medication for addiction treatment, right? Swapping drug for drugs, misunderstood. You can't participate in sweat if you are on MAT. So there's a lot of misunderstanding and information about there. So one of the things that I created was this IMAT tool to help not only the patient understand of the importance of what specifically like buprenorphine does, but helps the provider explain it, and explains it to the provider of why, you know, we don't just look at it as medication. We look at it really as, I refer to it as like good medicine, because we know the importance of having MAT out there. We know how it stabilizes. We know how it reduces overdose death. We know all the benefits of it, but getting it into our tribal communities and making sure that people in our tribal communities have access to MAT is really huge, but also then getting rid of the stigma associated with it. So again, like breaking things down into our cultural lens and like how we view things. So like, here's a medication coming on board. is it just like any other medication? No, this medication actually, like for the mind, like stabilizes it, right? We know it reduces cravings. So we share that you're able to, you can start therapy, you can focus more emotionally, you feel more balanced, you're able to manage your feelings more, like spiritually. Obviously, one of the things it does is reduce overdose death when that medication's on, but you're able to participate in ceremonies, learn more about your culture physically. It helps with the withdrawals, helps people just feel normal again. And so this is one way that we really try to help people understand the bigger need and the reasons behind the medication, and to really get rid of the stigma. Next slide, please. And then tribal substance use navigators, that is a really neat thing to make your own in your tribal communities. And you can make them into tribal overdose response navigators. We have done that, and we've made tribal substance use navigators. The beautiful thing is, if you don't work in a clinic, your tribe can create this position. There's all these different opportunities of where a tribal substance use navigator or overdose response navigator can live. Like they can work in the tribal housing department. That'd be a great place for them. But here's just an example of all the different places that substance use navigators can touch. Overdose response navigators in our community, they go into the homes, they go post-overdose, they work with the families, they create safety planning, they help prevent fatal overdose, and they make sure that people get connected to the right resources, and they have the education, and the harm reduction principles behind that. Next slide. And then we talked about like the healing from historical trauma and how huge that really is. Next slide. Sometimes services kind of recolonize us, right? Like making us go through hoops. Having these services built that were never designed with us in mind in the first place. And we do face a lot of incarceration from substance use as Native American people. So one of the things that we did, we created a welcome home ceremony. And this is the way that we can welcome people back from inpatient programs or from incarceration as well. And it was designed really to take the stigma and shame off of them. And that the middle picture is a card, and when you open the card up, it actually it has a recording of a Native prayer, like our actual one of our own Native prayers. And so the person can see what it says in English, and then they can hear it on audio when that card opens up. But this one is part of our welcome home one, and then there's the package. Next slide. That's what's inside of it. Here's some pictures of people attending different welcome home ceremonies, but it really brings people home in a good way and helps them transition to say, you know what, you're coming home from incarceration, you're coming home from prison. What you needed to do and how you needed to live there and survive isn't for coming back to your tribal community, right? And addressing the PTSD and the trauma and all those survival skills. But nobody stops and acknowledges, like, that's like them going to war in their minds, right? And so when they come home, still having that mentality, still having that fight in them, still having like, people better not disrespect me attitudes. That's really huge when people are coming home from prison. And the world's different out here. We know it doesn't work the same way. And so helping them cope with that and finding ways has been really instrumental. And having people who've been to prison and have like successfully come home and are leading healthy, good lives, have them be there to support them has been instrumental. Next slide, please. Collaboration and partnership, a huge piece of this work that we do in helping build our communities up. Next slide. So this is just an example, working with our law enforcement, working with our tribes, working with other organizations, healthcare organizations, any stakeholders and community members, giving them a platform and lifting them up too. Next slide. Advocacy and policy change. That's another huge aspect of harm reduction and getting that weaved in there. Next slide. Community champions. Policy change can look at helping healthcare systems lower the barrier to care, helping them destigmatize, on the county level, on the state level, on tribal level, but really helping people advocate for and decolonize those services to make sense for their community, and knowing that we've been hugely impacted by the war on drugs as well. Next slide. adaptation and flexibility, really just helping tribes create those harm reduction strategies is huge, and that it's flexible and not rigid like we talked about in the beginning. Next slide. So an example of that, we started creating detox care comfort packages for people, and all it is a comfort care package, but man, it lets them know, like, we know you're hurting, we know this, this is a hard moment in your life, we're going to get through it together, and empowering them to have a successful detox so they don't return to use, and getting them connected with the right support is huge. Next slide. And then meeting the ongoing needs as well. So creating things for our two-spirited community, making sure that we're touching bases on youth prevention, that we're working with our youth, that we're, making sure we're having a lot of education and outreach. Harm reduction is in all of this, right? Next slide. So in summary, the one thing I'm not going to read this slide, you guys can read it, but understanding that the work is sacred. This really is sacred work. It's, an honor to be part of it, and really to come alongside someone and walk with them when they felt hopeless and that there's no way out. That's really the honor that we get to do, is, every individual that we come into contact with, that we're able to help change their lives. And help our whole community heal. So we don't just look at the individual, we look at their family and our community. Next. And then some of the things in the toolkit, there's a lot of videos. So if you click on the link, there's more links inside of the toolkit, and you can click on videos and different examples. There's like a Narcan video. This is a clip of a video of a gentleman here talking about what harm reduction is in our community. Next slide. All right, I think I was a little over time, but I got through it all.
Thank you so much, Arlene. I mean, that was such a rich presentation. Just thank you so much. And I'm going to get right to the questions because there's so many of them. And you can tell the emojis. Thank you, everybody, for the emojis. They're wonderful. We had several questions about the what you talked about early on about doing the harm reduction at an event, and that not having initially thinking about the kids being interested in this. Kind of what did do you have recommendations for educating youth about harm reduction, whether it be in that kind of setting or elsewhere, and making sure that it's age appropriate for the youth, for kids particularly?
Right. I think of the education around fentanyl and counterfeit pills and naloxone. And so I think those are super age appropriate because, we have kids with older brothers or sisters, and you might think, you know what, that's a 10-year-old. They're not going to, they don't need to know. They absolutely do need to know because they can have access. We just never know what people have access to in their home because of who's coming in and out of their home as well. And so even parents who are using, and so one of the biggest things is the education around counterfeit pills, because people think, oh, it's safe, it's a pill, and it's far from just being a pill, right? And so giving our youth that education is huge, and doing it in a way where it is age appropriate. And my daughter has known how to use naloxone since she was 7. And one of the reasons was because my mother was on prescription painkillers, and so she kept them in a lockbox. But it was like, man, if my mom ever drops a pill, or if my mom needs it because she took too many, accidental overdose, is a huge issue as well. Well, most overdoses are accidental, but that situation is real too with our elders. We talk about that in our tribal communities because there's been stigma around, well, that Narcan is not for, we don't need it. We don't do drugs here. And then we say, well, you know what? We have children we need to protect. We have elders who get medication changes. We have elders who forgot they took their medication. And so, and so we really try to frame it that it is protecting all of our community. And so she's known how to use it since she was like 7. She knows the dangers and what to look for pills. So I think I don't think it's too early to ever start.
Really, really excellent points, Arlene. Thank you. One practical question is, were there like kid prizes that you suggested or discovered for harm reduction programs that still involve some level of harm reduction education?
Yes, like the squeezy toys, like the stress toys, coloring books are a good thing, and like the colored pencil sets, I've done those with like just messaging on those as well. So they have like good messaging on there, whether it's prevention, you can create whatever that looks like, but those have been really good toys, and the kids love the squishy things. And then they have stuffed animals where you can actually you can customize the t-shirts, and so the like stuffed animals are another good thing.
Thanks. And then a lot of people wanted to know what you actually put in your overdose reversal kits.
So we do a CPR mask, literature. Some of our bags that we have are tagged on the outside that says don't forget to leave home without me, as a reminder, like take me everywhere you go. And then it will say this bag has been prayed over, and we've, like this bag has been smudged and prayed over. And some of the messaging will be like, stay safe, we need you here. And so we put different messaging on there, and then CPR mask, gloves, and then naloxone. So we will do like a whole box. Then naloxone, the nasal spray for Narcan, they've changed their boxes, so now they're like really long and large. So we'll put one box in there, and then we'll take doses out and put those additional doses in there as well, because we know that people could use 4 to 6 doses sometimes on a fentanyl overdose.
Thank you, Arlene. Just to comment, the richness of your culture first approach is just so pervasive and strong. Thank you so much for everything you're doing and for sharing this with us. One person asked about any advice you have on how to navigate community members who behave in a dominant and antagonistic way towards others due to substance use. How do you not isolate these individuals?
That is a great question. I think once we start crossing the line into violence, that there is that it's appropriate with law enforcement, right? Like I said earlier, we can't criminalize the substance use, but getting them the help that they need. And so a lot of tribal communities, because there's so much entanglement, they have gone to banning tribal members when there has been like violence occurring, disenrolling tribal members. I don't advocate for that by any means, because I like to see people get the help that they need, but there is this real huge intersection between that. And so, but once people start crossing the line into violence, law enforcement is appropriate. There is like other justice programs that are out there to where, like, if you have tribal courts, they're able to intervene and make it a different thing. I know, like, for our application for like sober living, part of that application is, how have I harmed my community, and what am I going to do to make my community a safer place? And when we are interrupting people's return from incarceration, people come right home from prison with that same prison mentality. And so one of the things that we've done, that's part of the welcome home ceremonies, say, hey, you don't have to be that, don't do that to our community. And having a group of people that will stand up to them, because it is common, right? I mean, it can happen. And so that has been helpful to interrupt it, to say, I don't need to bring that prison mentality and thinking back to my community. These are my sacred people. And some of that work goes into prevention with our women are sacred, our youth are sacred, and how are we protecting our elders and women and children, right? Like the men, helping them find their place as the protectors and kind of shifting that and changing it. I know it takes time, but the messaging there and like making those our huge values again, instead of like values when we grow up and like, oh man, I can outdrink you. I can, going to prison school because that's what my uncles did. Interrupting that cycle is huge, and this is part of it.
Thank you. Excellent response. Thank you. A practical question. Can you give an example of how you've braided funding to be able to support these various efforts?
So one of the things I know California does a really great job on harm reduction and supporting programs. So we've tapped into a lot of harm reduction programs. we've tapped into recovery programs nationally too, and because there's a lot of national funding out there as well, so it's been kind of just looking for a lot of different funding. And we also just recently received a $5 million housing grant, which we're super excited about because our whole basis with that is considered housing first. So there's some national, like, but look for harm reduction funding. That one, man, they really want to see people, and they're more flexible with their funding dollars, because some of the funding, especially like the federal funding, is really rigid on some of the things that you can do. But like specifically California has funding for contingency management. I don't even tap into that because they put a cap on it. And I use harm reduction funding for the contingency management because we spend a lot of money on prizes and gift cards in our recovery one and in our wellness journey. So
Thank you. Do you provide any peer-to-peer support groups that are culturally appropriate? If so, do you implement a 12-step program that is in a customizable manner?
So we have, yeah, all of our services, like 6 days a week, are all peer support ran. Everyone has lived experience that is part of our team, and mostly I'm the only one who has 0 incarceration, but everyone else has like 15 years of prison. That's our case manager has like 15 years of prison. So, and then all of our other workers have had, long stays of incarceration. So everyone is, yeah, the whole program, everyone. As a matter of fact, we just hired a new person for the position for family advocate, and that was a really big thing, is that they actually had lived experience.
That's it. Wonderful. It's just part of having individuals with living or lived experience as part of your program. A question about, are youth included in medicine gathering as a way to contribute to harm reduction in the community, while also having elders imparting traditional knowledge? This is wanted to clarify youth that are not struggling personally with addiction, but might have family members who use or are interested in traditional medicine or harm reduction.
That is a great idea. We just received funding to do a focus solely on the youth. And so we're going to do equine therapy. We haven't done like I do an elders coalition. And so that has been separate. But one of the things our elders coalition is going to specifically focus on is connecting with the youth, and then connecting messages to the youth as well. And so that's going to be a large area that we're actually going to be working on more, is connecting them. And so I think that's the perfect place, is to just be connecting youth and our elders, whether it's substance use related or not, because that is a lot of the prevention work that's there.
Thank you. And we're almost at end, but I was going to ask one final question. Unfortunately, we can't get to all these great questions that folks have asked, but for those individuals who are just getting started, what partnerships, what other factors or things do you think are important to build effective harm reduction services with their local and Indigenous communities?
I think readiness for the community, right? I work with some tribal communities, and they're ready for the overdose deaths to stop, but they're not ready to hear about syringes and how that actually saves lives, because they're just not, the community's not ready. And so community readiness is a huge place to kind of assess. And like when I work with communities, I always look at their ecosystem of what resources they even have. Do they have a local syringe? Partnering with a local syringe, it doesn't have to be your own, that's nearby, partnering with the public health department, like where can you kind of start building that up? And then some communities aren't even ready for Narcan, and some communities have a lot of stigma just in Narcan, right? And I'm like, well, we should be really far beyond Narcan. We should be talking more about these other resources. But I think, that's a really safe place to start, is to be thinking about how ready it is. And we're very respectful to our tribal community and our elders, and our community in general, that, we're not, we promote all the safety, health, and wellness, and we've been really well received in the counties that we work in. But not every community is ready for that. And so kind of easing into harm reduction. And, but that's the beautiful part about it, is that you can ease into it. And once it takes root, and once you have people on board with harm reductions, like, there's no going back. I always say we got one more harm reductionist, and that's my goal. I'm going to turn everyone into a harm reductionist.
A great goal. And you have a wonderful community readiness assessment within your toolkit too, that folks can use. So
Yep.
we'll take a look at the toolkit. It has these wonderful links to just the courses that you've done, these resources. It's just such a wonderful tool for folks to use. Arlene, thank you so much for spending this time with us, for sharing your wisdom, your extensive knowledge, and this incredible toolkit that you've put together. Really, thank you so much. And you can see from all the emojis, we are all very appreciative of the work you're doing and all the information you've provided today. Thank you.
Thank you very much. It's been my honor and privilege, and I love all the emojis too. I can see them all floating on my screen.
Great. Thank you. And I think the final slide is just the NOPM website is on that, but there are many resources, including everything from today's web forum will be on the website. Thank you all so much for joining us for today's web forum, and enjoy the rest of your day, and join us for subsequent webinars. We'll be letting you know when those are going to occur. Thank you, everyone. Bye-bye.